fine. Okay, I'm sterilized, yes. Thank you. Thank you. I know. Just want to be careful with this one. It's really no problem now. I know it's late, but this is obviously more important. Can I have their chart, please? Anybody? Okay. Thank you. And this is the one that you filled out for patient 0106. Okay. So with the two of you, you can stand by, although I do have patient 0106 under control. Yeah, they're stabilized now. You did not administer the adrenaline, but that is okay. I counteracted it with a actual sedative, and then we proceeded to put patient under general anesthesia, propofol, 10 milligrams per, I think it is half hour or hour. And yes, we will let the patient sleep once surgery is completed, but until then, you can stick around. Just make yourselves comfortable. Stay away from the sterilized products. I appreciate you setting this up for me, and we will get this completed and save this patient's life. So the intake on patient 0106 has been completed. Drug test showed what results. There's nothing here. Okay. Okay, did you... So they are catheterized. Okay, that is not a way of taking a urine analysis. Technically, patients should have been catheterized, not sampled by when they came in that way. It's okay. Anesthesia has already been administered. They've not been sterilized yet. I can do that. They have not been prepped yet. I can do that. Vitals. Their vitals are right there on the machine. Well, I'm looking at you because you said you were the one who did the intake and... Okay, so vitals, I guess, are taken. I am going to take some vitals just to be careful. Surgery has not been completed yet, and aftercare. The patient's name is not here, nor date of birth, nor their allergies, so they've never been here before. No worries, that's fine. And the reasoning for being here is what? Okay, it's under notes. Quickly, we'll review this, and then I really have to get this done. Patient came in weary and visually ill. After admittance, vitals and inspection showed infection on recent tattoo. Symptoms on skin showed peeling, holes, red rash, causing the epidermis, and symptoms on the upper epidermis showed peeling, holes, red rash, causing other symptoms internally. High fever, coma, passed out, you mean. Vomiting, blurred vision. Patient is immediately rushed to surgery for tattoo removal. Current vitals weak and waiting for Dr. Karuna for surgery. Tattoo should be cut off and infection drained. Infection site needs sewn up. Details to be announced. Okay, so I actually had one of the girls up front call me on the way here after it was reported. This has been all over the news, so this basically SoundCloud rapper, is that correct? Yeah. They were practicing out of a warehouse, known to be from somebody considered a lying artist that is now a threat around here. What world are we living in? What a time to be alive. Okay. So they got a tattoo from this wrapper, and now it is infected, and now they are here in the ICU surgery unit. I know you two are students, and that's completely okay. You guys did the right thing regarding, I mean, just be very careful with the drug test next time. Gonna scratch that out and put no answer. And this patient is not in a coma. If they were in a coma, we would not be administering propofol. So, let's see. Let's get them sterilized. Well, they look okay. Yeah, I don't mind spraying them down. And then see the infection site. You did not put a sheet on this patient yet, correct? Okay, I don't even know where to begin. The redness spreads from here to here. Where's the actual infection? Okay, yeah, I'll lift it up. Okay. I'm just gonna move there to the side. Oh, wow. Yeah, that definitely needs cut and drained. That's okay though. They could not feel it if they tried. Okay, let's get them, well actually, you know what, let's get some vitals first and then we will sterilize them. So. Yeah, I'm looking at the machine. It does match. I just wanted to be safe, okay? It's not that I don't trust you two. I just want to make sure that something this severe is taken care of well, especially on such short notice. We didn't really have time to prep, did we? But patient definitely seems stable. Okay, let me get a temp just to be sure. Patient clearly cannot have oral temperature right now, so we'll just slip it under the arm. Be very careful. Patient definitely has a high-grade fever at 102.5. Technically not high-grade, but it's definitely up there. 103 would actually be concerning, so I guess we could put it as high-grade. So vitals. The heart rate's normal. But the, again, fever... Okay, so let's get sterilized and prepped. I will spray the patient down. Here, could you place this chart? Thank you. Let's see. Okay, sterilized bottle, correct? Just what you could put up at the time. Okay, so hopefully it will not trigger any hurt feelings. Okay. Yeah, I'm assuming you cannot get this piece of hair in the back, can you? Thank you for fixing that. I appreciate it. Don't want to touch hair whenever we're sterilized. Okay, so I'm just going to spray around their body. Okay. Get them cleaned up, and then we will put the sheet on. And then get to the, okay, prep. them covered up very quickly. Right below. Okay, we have a blanket set for if they need it afterwards. Now let us get them sterilized. So they have been vitals prepped and sterilized as of right now. Well, the actual surgery site, but the body has ultimately been cleaned up, so there are no stupid questions. What is it? We would have washed them down with a body wash, actually, that makes sure that they are 100% sterilized, but due to the circumstances of how quickly we have to do the surgery, we are using what we can get. So, for example, this alcohol pad. Okay. Alright, I'm just gonna wipe down the surgery site now. I don't even want to touch it. No, this won't irritate it more. Thank you for your question, but no, it won't. Just gonna hold them down like this for a moment. Okay. Let's get a little bit closer to the patient. Surgery site has been sterilized. Now, I am going to apply, although they are under anesthetic, another local or topical anesthetic. I would also like you to apply this to the patient's site or have the local nurse, one of the girls up front, to do this. Okay, I'm just gonna dab. Okay. And last but not least, just going to apply some water to the site, just the warm water over here in the cup. So we're going to put this on the surgery site. The skin's going to kind of absorb it very quickly. As it is infected, we do have to definitely understand that the skin is very sensitive, therefore taking in as much nutrient or what it can find as possible to potentially heal itself, but it is so beyond repair naturally from the body that we do have to intervene. That is why this is such a serious issue. That is why the body's caused symptoms. The immune system has started to attack the infection, causing the body to become very weak. And when the immune system obviously started attacking this infection, all of the bacteria on the upper epidermis of the skin went under into the bloodstream, causing flu-like symptoms, illness, and things like that. So let's get this fixed. Okay, so I'm just going to get a little bit of sterile water here, about 2 mLs. And we are just going to apply this to the skin. Alright, that is absorbing very quickly. We need to actually work a little bit faster, so. Okay, now that the incision that I'm about to make, the site around it is definitely absorbed. Let us get right into it. So I'm actually going to be using this needle right here. Simple sewing needle, sterilized, actually provided from the hospital. This is actually a medical needle. Usually we would use a scalpel to cut into the infection site, but this is such a sensitive area that we need to make sure that we're careful. And this is just medical thread. It is used to stitch. I did get a longer thread here because I'm technically just going to open up, drain, and then sew as I go along, okay? So, alright. So I'm just gently going to poke. The entire area is numb. Patient does not have anything to worry about, even if propofol was not working or something was wrong to where it wasn't being administered correctly. But patient has nothing to worry about. So what I'm going to do is I'm actually going to just poke the area here. Okay, so I am cutting around the area. Yes, we are going to have to get rid of the skin here. So please disregard what I said about going and sewing through it. This completely needs removed, so. I'm just going to go under and cut, removing the entire upper part of the skin, aka the infected tattoo itself, and then we're gonna dig out the infection underneath. Okay, so. Yeah, that is definitely infected. You can smell it. I'm finding it a little bit hard to get the entire upper parts. So I'm just going to take this light and I am going to get a little bit closer and we will get the skin up. It's a little bit harder. You want to get just around the infection. Some doctors do not care and they will cut way above the infection line, leaving a bigger scar, potentially causing the patient to have body dysmorphia later on in life, self-esteem issues, depression, and anxiety. But I do care, and I want to make sure that this looks as quote-unquote aesthetically pleasing as possible. I personally wouldn't care about those things, but some people do, Some people have to keep an image, and this person obviously had a tattoo because they wanted to keep a certain image. I myself have had them. Now I realize, my mistakes and where I did and did not want them. There's nothing wrong with tattoos, but you understand what I mean. So I'm going to turn on this light. It's going to be a little bright for those, you two in the back, basically. Okay. Just... Okay. There we go. Getting a little closer, I noticed that this infection's a lot deeper than I thought. Okay. Alright. Okay. I should actually have it from now. Let's see. Peeling it. Okay. I'm gonna need some gauze. It's starting to leak already. It's a good sign though. can. Alright, so that definitely makes my glasses fog up. We need to get better face masks, not a paint mask that I know you guys tried, and I appreciate it. So, can you guys get some gauze pads for me? Thank you. Going to spray this down a little bit with disinfectant. Okay, so I do have disinfectant in a cup over here. Also, what I'm going to do is just take it, put 1 ml instead of 2 mLs of the water. I'm going to put 1 ml of sterilization, whatever, help the infection. I was saying de-sterilization, I do believe. I'm sorry, it's very late. And I'm just going to spray into the infection site that I just cut, and then we are going to press kind of like a pimple to drain the infection and then sterilize it again. And then we will sew them all up and apply a cream, kind of like New Skin, if you've ever heard of it. It's like a little bottle. You can't see it. If sunlight gets in it, it ruins it. It causes new skin to grow in a way. Okay, yeah. And then they'll be all done. I actually have a little box of Cheerios to offer them when they wake up. It doesn't look like they have eaten much since the infection. And then we'll leave it up to the nurses. When I stop administering the propofol, it takes about 10 minutes for the patient to wake up, but depending on the shock that they were in, coming in so sickly, they will probably, it's more probable for them to wake up beforehand. So let's just rinse this out. Okay. It's about 1 ml. We have 10 mLs of sterilized liquid in here, so I'm just going to administer to the site. You know what? Oh, this is pretty bad, so I'm just going to... There we go. Alright, so I actually gave 2 mLs. And now we have the sterilized pad, gauze pad, and let me just... Patient's vitals are actually speeding up, meaning they're a little bit stressed, so warmth can definitely help with this. Yeah, I'm just tucking them in a little bit more. Could you two come here and just under-tuck them? Thank you. Yeah. Okay. Alright. You go ahead and do that. I'm just gonna... Okay, so... Okay. Just getting around the side, pushing. Oh, wow. Hopefully, if the patient ever gets another tattoo, they will get it over the scar and from a trusted source this time. So I'm just draining the rest of the infection. Let's see. It's unfortunate that it's on the right side of the patient. Okay, at this point, I am going to need another gauze pad, so thank you for leaving the box right here. We're actually going to refrain from sterilizing this one. Obviously, they come like that, but too much sterilization will actually dry the site out, and then whenever we sew up, can cause another infection, so I'm almost done. Now we're just going to dab. Okay, squeezing around at this point. One more time. Okay. Alright, they should be good. Let's see. Alright, now I'm just wiping it. Will irritate a little bit, but nothing that will be too painful. Excellent. Alright, so our next job is to sew them up. I have the needle and thread. I'm just going to check out the infection site one more time with the light here. Okay, let's just get close here. Yeah, infection's pretty much gone at this point. Okay. I'm just getting excess drainage. Alright, so I am going to just administer here very half an ml of sterilized liquids in here, just so we know that the site is cleared up. It doesn't look too dry, so I don't think we have to worry about, getting that way. So let's just go ahead and start the sewing. Okay, I'm just holding the back of the gauze pad as a base. Let's see. Okay, probably about one more and then we'll dye it. Okay, so we got the needle. Let's just go ahead and dye here. Okay, it's tied. Where are my other scissors? Thank you. Perfect. Okay, so patient is pretty much done. Surgery site sterile, everything. I don't need to apply sterilization, but I am going to dab it a little bit just to be safe. You know what? It's not actual direct liquids, so it'll be okay. just apply some cream. Natural A&D ointment, just to make sure the site stays hydrated and clean at the same time. So. Okay, just massaging that on the site. Alright, so why don't you take the IV out for the propofol, and why don't you come over and make sure the patient's pillow's fluffed and everything, because they will be waking up. Their heart rate's a little bit fast, meaning that they're more likely to be metabolizing it faster. So I'm just going to get some vitals while you do that, and yeah. Yeah, go ahead. Just pop the tube out and then come over and remove the IV before they wake up, so they don't wake up stressed. It matches, yeah. Matches. Let me just get one over here next to the site, see if blood's pumping to the site correctly. Okay, perfect. Alright, so last but not least, let's get a temp. Oh, you need me to give you a band-aid, that's fine, sure. You actually should be putting a gauze pad over the site, but a band-aid will do. Again, we have to do this very quickly. And so the patient is already waking up. Please hurry. Seriously? Get that on them, okay? You know what, I can do it. Let's get a sterilized gauze pad over here. Thank you. Alright, so hello. Hi. No, shh. Okay, heart rate's going up. Hey, it's okay. It's okay. Shh. I'm just getting a temperature. I'm a doctor. I am Dr. Karuna Satori, MD, medical doctor, and I am here to you know what? They're slowly waking up. I'll just get a temp. Slipping this under your arm, nothing to worry about. Nothing to worry about. Okay. Temperature actually has went down, and they are at 101.2, so no more administering through the IV, obviously, so what we're going to do is just give them 2 Tylenol. They are swallowing. I can see it as there is no more drool coming in their mouth, and give them 2 Tylenol and coherent. That is when you can administer Percocet, potentially Vicodin. It all depends. So the pain level should be a good 7 or 8 once everything wears off, so definitely they will not be complaining. You give them what they need. If pain is too much and you could see visual stress, higher heart rate, and things like that, I do suggest administering maybe a fentanyl patch near the site. Morphine is not something that should be giving for outside pain. Fentanyl is more of the closer to the skin type drug, as well as Percocet, given for teeth. So definitely write that down, have the girls up front take care of it, and like that. And you, hello, I'm just going to remove these. You had a very, very serious close call in regards to a tattoo that we heard that you went and got from a sketchy little person, sketchy little rat, I like to call her. And we've heard of her in town. She's been making her rounds. You are actually the first to end up in here, but we have definitely been put on watch for people like you, and you are basically proof that, you know, the person is practicing very, not okay, illegally, and the police have been notified to find this person. And I just want to let you know that you had a very close call with death. Your temperature was at 102.5. 103 is definitely something to be concerned about, and 105 is actually pretty dangerous for an adult. Now, the body can take up to 107, but after that, your brain's pretty much frying. Now, we administered propofol. My students here basically set up the surgery table very quickly. It's very late. You know, we didn't have time to get you very, very, you know, sterilized and thing, but I promise you that the surgery site is going to be completely okay. You are going to be fine. I got you some Cheerios. You look like you need to eat after that. You should already be feeling better. We drained a large portion of the infected site. What exactly was that tattoo anyway? All the card symbols. Okay. That looked like a big black hole when you came in here. And you did come in here passed out. So who brought you? How did you even... So you do know who this person is. You had 2 people at your house. Okay, we might need to file a police report. I'm going to actually call the police. You just don't even worry about it. But, yeah, I want you to sit and relax. You've been through a lot the past 24 hours. Do you remember anything during this at all? Well, I ask because we need to do a drug analysis on you, so... Okay, yeah, absolutely, no worries. We'll get that done, and you just go ahead and rest. Now that you're out of surgery, we can actually admit you to the hospital. You technically are already admitted. We did surgery here in the room, but you are going to go back to your own room, get comfortable, and then we'll wait until the morning. But I will call the police, and I need you to file a police report. So you said 2 people were there. The tattoo artist person, and who else? An actual artist. Okay. Do you remember her name? Okay. She didn't say her name, but she was on the phone with who? A screaming ant. Okay. My goodness, you have no idea how long this has been going on. Alright, again, I'm sorry for this. You need to be more careful. Let me keep you nice and snug as a bug here, and you go ahead and take a rest. That propofol should definitely make you tired, at least, even though you're waking up from it. You know what? Go get the girl up front to have them administer the small dose of fentanyl. Yeah. Yeah, that thing's definitely pulsing, but it's definitely healing already, or else there wouldn't be that much blood at the surface, but... So you get some sleep, and we will wake you up in the morning, and that's all I got. My name is Dr. Karuna. I will be going home for the evening, but I will be back here in about 4 hours. So, thank you for not freaking out when you woke up, and I can tell that you knew that that was infected. That did not look like any kind of card symbols. That looked like health. So, but you go ahead and rest, and I will talk to you very soon. Thank you so much. If you need anything, just ask the nurses, and I'll see you very soon again.